Hi, good morning. Well, they have just started the mass immunization campaign here at the Roodepan Primary School. That is, of course, a suburb just outside Kimberley. We've seen some of the grade R and 1 learners being immunized. Some brave souls, I must say, that has been taken through here. But as from now, we've got 7 confirmed cases of measles here in the province. Of course, that is a total of more than 400 countrywide who are infected with measles. Of course, here in the province, 7 and then 4 within the Francis Bar districts, which include the Kimberley area. But let's talk to the MEC of Health in the Northern Cape. That's Moraping Lekwini. MEC, 7 confirmed cases so far. How are we treating those to make sure that it doesn't spread?
Thank you very much, Ulrich. Good morning to our viewers. Yes, currently in the province we have 7 cases, 4 in the Francis Bar district, 2 in ZFM and 1 in Pislegaseme. And I think the key message we are spreading as the Department of Health is to encourage our people to be vaccinated. Even our children from the age of 6 months to 15 years, they must get vaccinated because that's the best mitigating factor to ensure that we reduce the number of people infected of the diseases.
Can you tell us the symptoms that parents should look out for?
The key symptoms is a rash throughout the body. Some you become nauseous, some told dizzy, some headaches. Those are the key symptoms, which if you feel like you have such symptoms, you must visit your nearest hospital or clinic just for a checkup and to ensure that you really get medical advice. But today we are rolling out our campaign of measles, vitamin A and deworming in our schools. Like now here in Roodepan Lower Primary School, we're starting with the grade Rs, and throughout in the whole province. We are rolling out our campaign starting from today. We have employed extra hands, 38 extra nurses with extra personnel who will be working as your clerks, just to ensure that within this month, a month or two, our target is 303,000 young people we're targeting to inoculate or to vaccinate against the measles. But also a catch-up program which was interrupted by COVID-19 on vitamin A and deworming. And you know it's a good program because it's where we get them very young from grade R to ensure that they grow up healthy, but also enhancing our healthy lifestyle program throughout in the country and even throughout in the province.
Let me see what we saw during COVID-19, and you've spoken briefly about it, is that people are vehemently opposed to getting the vaccination for COVID-19. Have we seen that translate into child immunization, measles and other vaccination campaigns that people normally do at either at the health professional or at government clinics?
Well, of course, I must just correct. Well, it's not everyone who refused vehemently. It is some pockets in our province, of course, in the country maybe, people who do not believe in vaccination. But luckily now, yeah, with the measles and the vitamin and deworming campaign, we're getting concerns from the parents. And as I'm speaking to you now, all the grade R learners now here in the school we have received confirmation from the parents, giving us consent for their children to be vaccinated, which I think is a very positive sign. And I think what we need to just educate our communities to ensure that we open ourselves up, right from our children, even ourselves, even as elderly people, to get these vaccinations, because they will help us to mitigate some of these diseases, but also will help us to keep us healthy. It's not a new thing. Throughout in the world, people get vaccinated. So vaccination, which is of course tried and tested by our epidemiologists, by our scientists, is the way to go, where we must mitigate some of these dread diseases. And I think today we're here as a department. Most parents have given consent to their children, right grade R's, very young children, and you could say many of them were even crying. They got their jabs, and everything is systems, all systems are, are going very well, and we are happy. So today we are implementing this whole program in the 5 districts. So we want to ensure that we must not increase the 7 numbers of people we've been vaccinated. We are currently giving attention in our hospitals. So we want to ensure that we keep the numbers there at 7 and not to increase. So the key message to our people, to our parents, our communities is we must get vaccination for measles, but also to ensure that there's a catch-up program for vitamin A and deworming so that our children remains healthy.
Let me see, just a final question. You did briefly touch on it. More personnel, more money for this campaign. How much are we talking, and where in the budget is this coming from?
Fortunately, Ulrich, with the midterm budget review, Health Department got extra monies, specifically just for human resource, that we must employ more professionals, whether it's your nurses, doctors, and other disciplines in terms of health professionals. So we have received some few good monies, which we are putting to use. So the date professional nurses we have employed and the clerks is from that particular budget. It's few thousands of rands. But as you know, in the department, in the province, one of our key challenges has been extra hands. And I think we're slowly getting there. And you can see even now most of our last year student nurses are doing their ComServes, also giving us more more hands in our facilities, in these programs. So we are quite positive. And of course also very happy that at least we're starting the year very well. With extra hands, with some of course extra monies we have received, and we'll ensure that we will improve healthcare services throughout in the province.
Thank you very much. That's the MEC for Health here in the Northern Cape. Moraping Lekwene, of course, saying that they're very excited and they hope that this project or program is a success. 97% of more than 300 learners' parents gave consent for these learners to be immunized and to get the vitamin A boosters and other deworming immunizations for these mostly grade R and grade 1. Of course, they're hoping, of course, people who have not been getting their vaccinations to use this time to basically catch up on the immunizations that the children may have missed, especially during the COVID-19 period.